Hi guys, welcome back to my channel. Today's topic is the question that I get asked a lot is how do I clean my dental implant? So you've had an implant placed, you have a crown on the implant, and then your question is, do I clean it like a regular tooth? What are the techniques that I should use? What do you recommend? So this is what I usually tell my patients. All dental implants must be cleaned just like regular teeth. The reason for this is implants can get infections just like regular teeth can. The difference is that implants are made of titanium and natural teeth are natural teeth, and they have a ligament, they have blood supply. So the natural tooth can fight off an infection a lot easier than an implant can. An implant is mostly titanium and then it has a porcelain crown on top of it. So we really need to be careful when we clean around our implants. We have to be mindful that we're cleaning everything around the implant to ensure the health of your implant. It's very important that you maintain your regular hygiene routine when you have your implant, meaning you go to see your dentist every 6 months. You might actually be seeing your dentist every 3 to 4 months, depending on the status of your other teeth and if you have multiple implants. Some general dentists will have you continue to see your periodontist, such as myself, for those routine cleanings, or we might alternate with the general dentist. And that's really important because the implant itself has to be cleaned underneath the gum line. The proper tools need to be used by the hygienist, so usually we use titanium instruments to clean under there, and we're able to debride the implant fully, and that way your implant can stay healthy. And we're also able to take measurements around the implant and take x-rays and make sure that everything around the implant, the bone, the tissue, everything looks great. So specifically hygiene at home, what should you do? I would recommend a power toothbrush such as an Oral-B that has a round head. There's a new Oral-B brush that I love. It's the IO. It's really great. It has a lot of vibration and pulsatory movements at the head, at the round head of the brush, that really focuses on the junction between the gum and the tooth or the crown. So that's really important. The second thing is floss. However, when you're using floss, you don't want to just go up and down. You want to actually wrap the floss in a C motion around either side of the crown of your implant. That way you're getting underneath the gum line. And the third thing that I recommend is PROXY brush. So PROXY brushes are these little brushes that have bristles on them, and they're a little thicker than floss. They're able to kind of get in between some larger spaces. If you have larger spaces between your implant crown and your natural tooth, those are really, really good to use. And the next thing that you can use is a mouth rinse. I would just recommend an over-the-counter mouth rinse, Listerine, Scope, or a natural mouth rinse, and you can use that twice a day as well as kind of an adjunct to your normal brushing and flossing. So the bottom line is you must emphasize cleaning around your implant. You must clean it just like a natural tooth, if not more. If you guys have any further questions about implants, let me know, or hygiene around implants, put them in the comment section. Thank you so much for watching. See you soon. Bye.